Hi, Dr. Greg Mendel, your friendly anatomy professor. We're going to go over one more torso model because there's a little bit better view of the abdominal aorta and some of its structures. Come on in. Well, when we look at this model, we're going to look at a few things. First of all, we see the heart, and when we look at the heart, we see that the superior vena cava is visible here, and so, oops, this thing's really stuck, and so is the aorta. And so you'll notice the pulmonary trunk as it's leaving, and the pulmonary arteries are blue. Don't forget they are blue because they are deoxygenated, they are not a vein, they are leaving the heart, they are called arteries. And so when we look over in the lung, we see that these blue structures are arteries, not veins, because they are deoxygenated. They are going to the lung. They get oxygenated, and oxyhemoglobin turns it a brighter red. We never have blue blood, by the way. It just becomes kind of a dark red to a bright red. But the red color pictured here are veins. These are pulmonary veins, which are going to go back to the heart. And when they come back to the heart, they enter into the left atrium, and veins, red. So pulmonary circuits backwards. When we look at the rest of this, we see the aorta, and as the aorta is leaving the heart, there are three main branches that come off of it. The first branch is called the brachiocephalic artery. The brachiocephalic artery is going to come up, and there will be a branch that goes up into the neck and a branch that goes over. So we'll have the common carotid and subclavian on the right side, which is a branch of the brachiocephalic. The second vessel coming off of the aorta is the left common carotid artery. You can see it goes up into the neck. It will divide into this inferior or internal and external, not visible on this model. The third artery coming off of this is the left subclavian artery. You can see it goes up and kind of over, and basically it's going to go under the clavicle. So we see the aorta dip down, the aortic arch, it dips down as the thoracic or descending aorta, and it's going to pierce through a muscle called the diaphragm. After it pierces through the diaphragm, we see it coming out. It has a new name, no longer thoracic or descending aorta. It is now called the abdominal aorta. The abdominal aorta has 5 major branches. The first of which here is called the celiac trunk. The celiac trunk has 3 main branches. The first of which is going to go to the liver. That is going to be the hepatic artery. The second branch is going to go up to the stomach, which is called the left gastric artery. The third branch is going to be going to the spleen, which is called the splenic artery. The second major branch coming off of the abdominal aorta is the superior mesenteric artery. Down here we see the inferior mesenteric artery. So we have the superior mesenteric artery and inferior. Under the superior mesenteric artery, we see the left and the right renal artery and the renal vein here in blue. And so renal vein going over to the inferior vena cava. If we continue down on the abdominal aorta, there was at one point a red tube coming out of here, very similar to the blue one we see here, but since these are very flexible, some students broke it over the years, accidentally of course, it just wore out, but it became broke, and that was supposed to depict a tube here and a tube right here, which were the gonadal arteries. And so we'd have a gonadal artery coming out here and a gonadal artery coming out here going to the male and female gonads. Now we have the inferior mesenteric artery, and we have the abdominal aorta coming down and now branching into 2. We have the right and the left common iliac artery. You can see that they branch. We have an internal branch here and an external branch here. This is the internal iliac artery, the external iliac artery. If we back up just a hair, we can see the external iliac artery piercing through the abdominal wall and becoming the femoral artery going in the leg over the front of the femur. I believe that is it for this model.